Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Doctor, I've been having a really tough time lately with my health, especially with this recurrent cellulitis. It's been so frustrating because every time I think we're ready to go ahead with the knee replacement, something happens. Just last week, I had another episode of cellulitis right before the scheduled surgery, and we had to postpone it again.
I can imagine how disappointing that must be for you. It sounds like this has been a recurring challenge. Can you tell me a bit more about these episodes of cellulitis? How have they been managed?
Well, each time it flares up, it's the same routine. The area around my lower leg becomes red, swollen, and painfully hot. I usually end up on antibiotics, and it takes a couple of weeks to settle down. I've been on various antibiotics, and so far it clears up with treatment, but it keeps coming back. The last time it was just days before the surgery, as I mentioned.
It sounds quite disruptive. And how about your other conditions? You mentioned chronic pain and mobility issues as well.
Yes, the pain in my knees, especially the right one, has been unbearable at times. That's why I was looking forward to the replacement. I've been using a wheelchair more often now because it's just too painful to walk. The pain medication helps a bit, but it's not enough to get me walking like I used to. The fentanyl and Vicodin manage the pain, but I don't want to rely on them forever.
Understood. And with your COPD, have there been any recent changes or challenges?
The prednisone, I've been on it for decades now, and I know it's affecting my bones. I'm scheduled for a DEXA scan to check my bone density. My breathing has been stable, thankfully, but I keep up with the CPAP at night for the sleep apnea, which complicates the COPD a bit.
It's good to hear your breathing is stable at least. Let's also discuss your recent and upcoming tests.
Yes, the cardiac stress test went well. The cardiologist said my heart's in great shape, which was a relief. The colonoscopy is scheduled because of a routine call from the medical center, just to check everything is okay since I've been on so many medications.
It's great to hear your heart is doing well. Now, regarding the recurrent infections and the impact on your knee surgery, have you discussed any specific strategies with your orthopedist or a specialist in infectious diseases?
I've talked to the orthopedist, and we agreed to hold off on the surgery until we can get these infections under control. They suggested consulting with an infectious disease specialist, but we haven't set that up yet.
I think the consulting is a good step. Managing these infections effectively could potentially allow you to proceed with the knee surgery safely. Now, let me go over your recent lab results and our plan moving forward. Looking at your lab results, your CBC is normal, which is good. Your kidney function, liver enzymes, and blood glucose levels are all stable. The lipid panel shows your cholesterol levels are within acceptable ranges, though we could aim to improve the LDL and triglycerides slightly. Your CRP is mildly elevated at 3 milligrams per milliliter, indicating some inflammation, which is likely from the cellulitis. The ESR is also slightly elevated. Your MRSA swab was negative, which is excellent in terms of surgical considerations and infection control. For the next steps, we'll proceed with the blood work to get a baseline on your health markers. I'll coordinate with the orthopedist to form a comprehensive approach to manage these recurrent infections. We'll also keep an eye on your bone density and cardiovascular health, especially given the long-term steroid usage. It's crucial we manage these effectively to improve your overall health and mobility.
That sounds like a solid plan, Doctor. I appreciate you helping me coordinate all of this. It's been tough handling so many things at once.
Of course, I'm here to help you through this. We'll work together with your specialists to get you the best care possible and hopefully get you back on track for your knee surgery.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
I've been dealing with this persistent issue in my groin for quite a while now, and it just doesn't seem to go away. The skin is really red and sore, and sometimes there's this yellowish discharge. I've tried a few treatments before, but nothing seems to hold. The area feels itchy and painful most of the time.
I understand that must be very uncomfortable for you. Can you tell me more about the treatments you have tried in the past?
Well, I was prescribed a cream, I think it was an antifungal cream, and I used it as directed for a couple of weeks. The symptoms seemed to get a bit better initially, but after I stopped using the cream, everything just came back. It's frustrating because I follow all the instructions, keep the area clean and dry, but it still recurs.
It sounds like you've been quite diligent with the treatment. Recurrence can sometimes happen with fungal infections, especially in areas like the groin. We'll definitely look into other options today.
Also, there's something going on with my eyes. I keep feeling like there's grit in them, especially when I'm outside. My eyes water a lot, and it's quite irritating.
Has this been a long-standing issue, or is it relatively new?
It's been happening on and off for a few months. I thought it was just allergies or something, but it hasn't really improved with allergy pills. It gets worse with very bright lights.
Thank you for sharing that. Eye irritation like that can be quite bothersome. We'll explore some options for that as well today. Now, I also see here that you've had some difficulties with your medication refills. Can you elaborate on that?
Yes, that's been another source of stress. I take simvastatin and hydrochlorothiazide for my cholesterol and blood pressure, but there's been some mix-up at the pharmacy. Sometimes they say they can't refill my prescription because they need a doctor's approval or something isn't right with my insurance. It's confusing, and I end up missing doses.
That certainly isn't ideal, especially for managing chronic conditions. We'll make sure to straighten that out with your pharmacy to ensure you have a steady supply of your medications.
I appreciate that, doctor. It's been tough managing all these issues together, especially with my weight. I've been trying to lose weight, but it's a slow process, and when I feel down because of my health, it's harder to stay on track.
Managing weight is indeed a challenging journey, especially when you're dealing with other health issues concurrently. It's important to address each concern comprehensively. Let's take a closer look today and make a plan moving forward. Based on your history and the symptoms you've described, I'll summarize the key findings and our next steps. It is a recurring fungal infection, as indicated by your symptoms and previous culture results showing growth of Candida albicans. Given the recurrence, continuing with a systemic antifungal might be necessary. We'll also consider referring you to a urologist, as they might offer specialized care, including considering procedural options if these infections continue to recur.
I see, that sounds thorough. What about my eyes?
For your eye symptoms, the best immediate approach would be to try saline or rehydrating eye drops, particularly during exposure to triggers like wind and bright lights. If these symptoms persist, I would recommend an evaluation by an ophthalmologist to rule out any other underlying issues.
And the issues with my medications.
I will contact your pharmacy today to clarify the prescription approvals and ensure there are no further interruptions. We need to maintain consistent management of your cholesterol and blood pressure.
Thank you, doctor. It's been tough dealing with these issues, but I feel like we're making some progress today.
I'm glad to hear that you feel more supported. Managing health issues can be complex, but with a structured plan, we can address each concern effectively. Let's schedule a follow-up in 4 months to review your progress. However, if any issues worsen, please contact the office sooner.
Will do, doctor. Thanks for your help today.
You're welcome. Take care, and I'll see you at the next appointment or sooner if needed.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
I've noticed some redness and swelling around your wound. How long has this been going on?
Just noticed it this morning. It's also started to feel quite warm and itches a bit.
Those are common signs of an infection. Have you experienced any fever or chills recently?
Yes, I felt unusually cold last night and had a slight fever this morning.
Okay, that's important to know. We'll need to start you on antibiotics to treat the infection. It's also vital to keep the area clean and dry to prevent further issues.
Should I be doing anything else at home to help with this?
Make sure to take your antibiotics as prescribed, and you can apply a cool compress to help with the swelling. If the symptoms worsen or you notice any discharge, please contact us immediately.
Now look at question 26.
Good morning, everyone. Today I'll be discussing the importance of collaborative care plans in improving patient outcomes. These plans are designed to ensure all members of the healthcare team are on the same page, which helps in providing consistent and effective care. Firstly, communication is key. Regular team meetings and shared digital health records can facilitate better exchange of information. For example, when a nurse notes an improvement or decline in a patient's condition, it can be flagged immediately in the system for all to see. Next, involving patients in their care plan is crucial. It enhances their understanding and adherence to the treatment. We've seen a decrease in readmissions when patients are actively engaged in their health decisions. Finally, let's discuss the role of technology. Implementing user-friendly software that all team members can access is essential. It ensures that everyone, regardless of their technical skills, can participate fully in the care process.
Now look at question 27.
Maintaining a healthy lifestyle is crucial for your condition. Let's go over some self-care tips that can help manage your symptoms effectively.
I'm eager to learn. What should I start with?
Diet is fundamental. Eating a balanced diet rich in fruits, vegetables, and lean proteins can make a significant difference. Also, staying hydrated is important.
What about exercise?
Regular exercise can help, but it's important to choose activities that you enjoy and are easy on your joints, like swimming or cycling. How often do you currently exercise?
Not much, I'm afraid.
Let's start with something simple then. Perhaps a 15-minute walk each day, and gradually increase as you feel comfortable.
Now look at question 28.
When administering medications, always follow the 5 rights. Right patient, right drug, right dose, right route, and right time. It's our first line of defense against medication errors.
I've read about using barcodes to verify some of those rights. How does that work here?
Yes, our facility has a barcode system. Before administering, we scan the patient's wristband and the medication. The system confirms if they match the prescription.
That sounds like a great tool to enhance safety. What should we do if there's a discrepancy?
Immediately stop, check the patient's records, and consult the prescribing doctor if necessary. It's crucial not to proceed until everything is verified.
Now look at question 29.
You'll need a blood transfusion to help treat your anemia and improve your oxygen levels. Have you ever had one before?
No, this would be my first time. What should I expect?
First, we'll test your blood to find a match. During the transfusion, we monitor you closely for any adverse reactions. It's generally safe, but we take every precaution.
How long does the process take?
The transfusion itself can take a few hours, depending on how much blood you need. Most patients tolerate it well and feel better afterward because their body is getting the oxygen it needs.
Is there anything specific I should do after the transfusion?
Just rest for the day and drink plenty of fluids. We'll schedule a follow-up to check on your recovery and see how your body has accepted the new blood.
Now look at question 30.
Today, we're exploring the vital role of healthcare chaplaincy in our hospital. Chaplains provide spiritual support to patients, families, and even staff, regardless of religious or spiritual beliefs. Chaplains are trained to offer comfort and guidance during some of the most challenging times, such as dealing with chronic illness, end-of-life care, and grief. They also play a key role in the interdisciplinary healthcare team, advocating for patients' spiritual needs and helping navigate complex emotional landscapes. If you encounter a patient or a family in distress, do not hesitate to refer them to our chaplaincy services. It's an invaluable resource that can significantly enhance the holistic care we strive to provide.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1.
Welcome everyone to today's healthcare seminar. Our focus today will be on the comprehensive management of osteoporosis in elderly patients, integrating recent advancements and case studies to enhance our understanding. Osteoporosis is a pervasive condition affecting millions globally, characterized by decreased bone mass and increased fracture risk. It is particularly prevalent among the elderly, making it a significant public health concern. Let's begin by examining a case that highlights the typical challenges and considerations in managing such patients. We'll discuss the case of Mrs. Thompson, an 82-year-old female who presented at the emergency department after a fall at home resulting in a hip fracture. Mrs. Thompson lives alone, has a history of hypertension and type 2 diabetes, and was previously diagnosed with osteopenia. Her medications include metformin, lisinopril, and periodic calcium and vitamin D supplements. Upon her arrival at the hospital, an X-ray confirmed a hip fracture. Given her age and fracture type, she was diagnosed with osteoporosis. This diagnosis is primarily clinical, based on the fracture's nature and her risk factors, rather than specific bone mineral density measurements at the time, which aligns with recent guidelines suggesting treatment based on risk assessment and clinical presentation. Management began with surgical intervention to repair the fracture. Post-surgery, the focus shifted to her long-term recovery and osteoporosis management. This includes a multidisciplinary approach involving geriatricians, endocrinologists, physiotherapists, and dietitians. Post-operatively, Mrs. Thompson's care plan included calcium and vitamin D supplementation, adjusted based on her serum levels. We also initiated a bisphosphonate to reduce future fracture risk. This decision was backed by extensive research indicating that bisphosphonates significantly decrease the risk of subsequent fractures in osteoporotic patients. Her rehabilitation plan was comprehensive, emphasizing early and regular physiotherapy to encourage mobility and prevent deconditioning, a common complication in elderly fracture patients. According to a study by Harvard researchers, early mobilization post-fracture surgery is associated with significantly better outcomes in terms of reduced morbidity and mortality. Moreover, a key component of her management involved assessing and mitigating fall risks. This included a review of her home environment, adjustments to her medication regime to minimize hypotension, and the introduction of physical aids like walkers. Additionally, her cognitive and visual functions were evaluated to address all potential fall risks comprehensively. Another crucial aspect is the follow-up and monitoring. Mrs. Thompson was scheduled for regular follow-ups with her healthcare team to monitor her bone density, reassess her risk factors, and adjust her treatment plan as necessary. These follow-ups are vital for ensuring that the treatment remains effective and for making timely interventions to prevent complications. In light of Mrs. Thompson's case, we can discuss several critical points. First, the importance of a holistic approach in the treatment of osteoporosis, especially in the elderly, cannot be overstated. It involves acute management of fractures and long-term strategies to prevent future fractures. Second, the integration of services and specialties in managing osteoporosis illustrates the complexity of care required for these patients. Each discipline provides a unique contribution that, when coordinated effectively, results in better patient outcomes. Lastly, ongoing research and development in the field of osteoporosis treatment are crucial. Emerging therapies and novel interventions continue to evolve, offering new hope and improved outcomes for patients like Mrs. Thompson. By staying informed about these advancements, healthcare professionals can better serve their patients and potentially reduce the impact of osteoporosis on the elderly population. Managing osteoporosis in the elderly, particularly those who have already experienced fractures, requires an integrated, proactive approach. It involves not just treating the fracture, but also addressing the underlying bone health issues and implementing preventative strategies to improve overall quality of life for these patients. Thank you for your attention, and I look forward to our discussion on how we can continue to improve care for our elderly patients with osteoporosis.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Hello everyone, and welcome to today's healthcare podcast, where we delve into the complex and fascinating world of tuberculosis, TB, a disease that continues to have significant global impact despite being ancient. Our focus today is on the evolution of TB management, particularly in the context of multi-drug resistant TB and the promising strategies to combat this resilient disease. TB, caused by the bacterium Mycobacterium tuberculosis, primarily affects the lungs but can also impact other areas of the body. It's transmitted from person to person through the air when people with active TB in their lungs cough, speak, or spit. One of the most challenging aspects of TB management is the emergence of multi-drug resistant TB, which is resistant to at least two of the most powerful first-line treatment anti-TB drugs. Let's consider a case study that illustrates these challenges. We have a patient, let's call him John, a 34-year-old male who presented to the healthcare facility with a persistent cough, weight loss, and night sweats. Initially treated for regular TB, John's condition did not improve, prompting further investigation. Tests revealed he had multi-drug resistant TB, complicating his treatment options significantly. Managing TB, especially resistant strains, requires a multifaceted approach. First, we have the pharmacological aspect, where patients are prescribed a regimen that might include drugs such as bedaquiline and linezolid, recently recommended by the World Health Organization for treating resistant forms of TB. These medications are more potent against resistant strains, but also bring a higher risk of adverse effects, making monitoring and patient compliance crucial. Next is the public health approach. TB is not just a medical challenge, it's a social and economic one as well. Ensuring that patients like John adhere to their treatment regimens is critical but challenging. Non-adherence can lead to even more resistant forms of TB. Public health initiatives focus on patient education, improving access to healthcare services, and sometimes directly observed therapy, where healthcare workers observe patients taking their medications to ensure adherence. Another layer to consider is the epidemiological tracking of TB. Health authorities need to track and analyze TB cases and their spread meticulously. This involves sophisticated data collection and analysis systems to identify patterns and potential outbreaks of drug-resistant TB. Such systems are vital for proactive public health planning and response. Now, looking at advances in TB treatment, recent years have seen significant innovations. One of the promising areas is the development of new vaccines. While BCG, Bacillus calmette-guerin, has been the only available TB vaccine for nearly a century, it's primarily effective against severe forms of TB in children and not very effective against pulmonary TB in adults. New vaccine candidates are currently under development, aiming to offer better protection and reduce the incidence of TB globally. Additionally, the field of genomics provides new tools for better understanding the genetics of both the TB bacterium and the human host. By examining the genetic factors that influence susceptibility to TB and the response to various treatments, researchers are aiming to develop more personalized treatment approaches. This could mean adjusting treatments based on a patient's genetic makeup, potentially increasing the efficacy of the treatment while minimizing side effects. Lastly, let's touch upon the global efforts to control and eliminate TB. The End TB strategy by the World Health Organization aims to reduce TB deaths by 95% and cut new cases by 90% between 2015 and 2035. Achieving these targets requires international cooperation and funding, along with the implementation of innovative strategies in diagnostics, treatment, and prevention, particularly in high-burden countries. Managing TB, particularly drug-resistant TB, presents a complex array of challenges that spans beyond the medical treatment of the disease. It involves a concerted effort from multiple sectors, including healthcare, public health, and international organizations. Innovations in treatment and prevention, along with robust public health strategies, are essential to control the spread of TB and ultimately achieve elimination. As seen in John's case, a comprehensive approach not only addresses the immediate health concerns, but also contributes to the broader goal of global TB control. Thank you for joining today's discussion, and we hope it has provided deep insights into the ongoing battle against tuberculosis.